I was born with a bilateral cleft lip and palate in 1957. And so I had early on surgery. I mean, these doctors were state of the art for back then, and they did a very good job. My first surgery, I was 7 days old. And through the years, my mother said that she lost count at about 30 surgeries. So I've had upwards of that. And that was from birth until, or well, 7 days until I was 17. And the last two surgeries were extremely rough. They were very, very, very major, rough surgeries that took a long time to recover from. All these years, I had abnormalities that I wasn't even aware of because that was my normal. I didn't know any better, some of these things, but they have affected me over the years. And
How did you experience it? Is this where some of the sleep apnea came from?
yes, yeah, definitely. From my septum, my sinuses, septum on down to my throat, actually. So when I went to see my last visit, where I went to see Greg and Calli, I had a list, and Greg had told me, well, next time I want you to remind me that we're going to trim your epiglottis. So I was like, okay. So anyway, he started. Callie had been working on my septum a little at a time already, and it had improved slightly. So Greg started there, and well, Greg and Callie both started there. Worked on that a little bit, and I could tell a difference, more improvement.
Now, when you say your septum, how did this manifest? Wasn't the entire left side of your nostril completely blocked?
It was before I went to Cali, initially, yeah. And now when I breathe in, I can actually, without having to pull over to open it, I can just breathe in and I can tell the air goes through there. I can feel the air going through the other side now. So, okay, we worked on that a little bit and improved it, and then we went down to the uvula, and I could hear Greg saying, okay, we're gonna stitch this up. And I just thought, okay, And so he worked on that a little bit, and then he consulted. He always consults with Callie too, as he's working when they work together. He'll ask her what she sees, and she tells him, and then they collaborate on it. And they just work like just so perfectly together. It's amazing how well they communicate. And so she's, sees it and she comments and, okay, it looks good. Well, maybe a little more. Well, yeah, it looks good now. And so then he'll say, okay, well, then he'll finish up. So
Well, let's explain what was wrong with the uvula. So they were
the uvula was bifid, it's called, which is in two pieces. So I had these two pieces hanging down there.
shaped like
And
two tongues, roughly.
yes, yeah. What it looked like was two tongues, and at the very tip, they overlapped a little bit. It was just so. And you know what? I didn't know that. I did know after adulthood, way up into adulthood, I did because I saw pictures, right? And I'm like, oh, so mine doesn't look like that, So anyway, mine looks more like that now. It looks, he did stitch it together. It is like physically attached now, both pieces. So that just amazed me. And let's see, the next thing was the tongue. And I referred to it as he shaved it down, but he explained to me that he removed a piece of it, a portion of it. And so that is supposed to, and all of this is because of my sleep apnea. It's to correct that. All these steps, all these abnormalities from, up, in my nasal cavity all the way down, it's all has to do with my defects, associated with the condition. So
Now, when you
he
came when
just
you came to see us, you were having to use not a CPAP, wasn't it a BPAP?
Well, oh, I quit using it. It's a BiPAP, and I had to quit using it because it made me worse. I was exhausted, and I had tried it for several months, and I just couldn't do it, and I didn't feel like it was helping me. I felt like I was worse off. I felt worse.
And what was your quality of sleep before you came to see us?
Terrible, terrible. I had I would get the petechiae in the eyes, the broken vessels and things, and I would just wake up so many times during the night. The sleep study that was done on me a few years back, I stopped breathing 57 times in 60 minutes.
Wow.
So, and that, and I don't believe that it was just short little spurts. I think they were prolonged
Yeah.
because of the petechiae in the eyes. I think that was my proof to me that they were just prolonged. I was without oxygen. I was suffocating.
Is there a problem also with having to get up and go to the bathroom frequently?
Oh my God. Yeah, sometimes it could be like 30 minutes after.
Now
Like,
that was another issue we had to work on, and what it was there, you'd been catheterized a few times, I guess during surgeries, which is
a
understandable.
lot of times.
And so you had scar tissue all the way up and down the urethra. Every time they shove a catheter and force it in against that very delicate tissue, it causes a
Oh,
scar to form. The
man.
scars were blocking the free access of your urine to get out of the body. So
Hmm.
that's why it was such a strain. And what has it been like since removing all of the scar tissue in your?
Oh man, I can sleep now it's a combination of I believe the whole everything you did. Combination of that with the bladder and urethra and all those issues. But I have been getting stretches of sleep anywhere from 4 to 6 hours. I haven't done that in decades. Really.
Oh, glad to hear.
I would be happy. I mean, I'd be grateful if I could get 4 hours sleep. That's all combined.
And I think when you came to see us the second time on September 30th, if I'm not mistaken, Teresa, you had some difficulty moving around, even getting up on the exam table, right?
Oh yeah. Yeah.
And what was that coming from? What was the
Just
diagnosis on that?
well, there was a few. The back issue, my lower back pain, the bulging disc there, along with fibromyalgia.
So they had your diagnosis, fibromyalgia and bulging disc, right?
Yeah. Oh yeah, since 2009 is when that
Okay.
hit me.
And,
That was a VAX injury.
and how's it doing now?
Much better. Before, and it got better. It well improved when you did. It wasn't this last visit. It was one before that,
Right.
or two times ago or so. It was when you realized that I had the fibromyalgia. Um, and I told you what it was from, and you said immediately you said, "Oh, well, I can remove those heavy metals." Like you knew right off that that's what it was. And I'm like, "Yeah, please." So, you did that, and then like a day or two later, the cats like to get up on your lap, and of
Right.
course, but anytime that they would just step one foot on my thigh, it would like just send me, just wanting to fly up off the couch. It hurt so bad. And, I remember, oh yeah, that's right. Greg did that. So I took just my finger and started mashing around as though like a cat on my thigh. There was no pain, nothing. So then I started mashing other places, and I'm like, oh my God, that's gone. So it's much improved. Now I think that my aches and pains are just from it's just inflammation, it's inflammatory stuff, reacting to whatever I'm reacting to. And probably some old age and the tongue shaving, I call it. That's been awesome. And the epiglottis,
Do you
we're
understand why
circling.
why the tongue had to be trimmed? Do you understand why that was? It was so
Yeah,
oversized compared to the
yeah,
size
it
of the
was
mouth. It was so
blocking.
thick that when you
Yeah,
laid back to sleep, that's what part of what was blocking you.
I understood that right. As soon as you said, about the tongue, I went, oh, good, because I know, the relaxation, and then your jaw goes back, and then the tongue, it's like my tongue was choking me to death. So yeah, that's over. No more of that. And I would wake up whenever I woke up, right? Whenever it was, morning, noon, night. My split uvula would be stuck to the roof of my mouth.
Hmm.
And I mean stuck really hard up there where I have to take some water and like swish it around and work it off of there. It was just like sandy, that
I'm
that
sure there are listeners by now or people watching this testimony are wondering how in the heck we do that which we do.
mm-hmm.
It's really rather simple in the case of your septum was part of it. I think you'd had some nasal work done, some work done probably by an ENT or a surgeon to to correct the deviated septum.
Mm-hmm.
And then apparently an
The
accident happened after
accident.
that and
Yep.
back to where it had been before. So your left side was entirely blocked.
Yep.
What we did was to liquefy the tissue and then open it up, to which end, it doesn't sound very pretty to put it this way, but I had you use your own finger as the instrument and pushed it open. So we actually opened up the actual skeletal opening in the skull to allow more airflow on the side because it had been smaller on the left than the right as part of the congenital defect. And we are trained to see into the body, so we could both see that. And so we were talking about the best way to repair it. And that's what I settled on. And after getting the septum in place, then the next thing was to actually push the part of the skull outward and then re-solidify the bone structure. Was there any pain involved in any of that?
Only with my big fingernail that I had stuck up my nose, but other than that, no. No.
Well, yeah, if I had known we were doing it, I
It's
would have,
now
I
gone.
guess,
I came home and chopped it off. I'm like, I ain't doing that again.
probably told you to trim your fingernail in advance, but
Yes, yes. And don't forget the ink pen. Come on, you got to admit to that too. You're going to own that.
well, that's
So,
true. Kelly had a soft backed ink pen, so she washed her with a sanitary wipe and then
yeah.
used it to push the outer edge of the skeleton wider to make the additional focus. Now, if you're wondering, oh, how do we know to do how much? Because we're not using a fluoroscope, we don't have an X-ray on hand. I asked the body's own guardian spirit, the Hamiya, to tell me when it's the correct diameter, the correct opening, and then stop there. It's very simple.
Mhm.
And your body always has the embedded wisdom. This is our ancient Nordic healing tradition to tell us the right information. So we simply listen to the wisdom of the body. Well, I am so glad you're doing better, Theresa, and regaining mobility, sleep, all of that good stuff. And
Everything,
everything's going to
everything.
be working well for you now.
All the way down to the epiglottis. I mean, the way that you were talking about how you were going around it, like you were shaving it down,
Yeah.
that was the image I had in my head was that just this something going around it, circling it, spiraling.
Well, do you understand how that had happened in the first place?
No.
Okay, at some point or the other in your various surgeries, I don't know when it happened. Got the impression it's been quite some time. You had been intubated, and in the intubation process,
Mm,
there had been serious damage done to that tissue, sort of scar tissue all in front of and around and lining the epiglottis. So it's just a matter of getting back to the original
right.
size of the opening. So I'll bet food goes down easier, it's easier to breathe, etc.
Yes, definitely.
That's the case.
And the back thing, the lower back is the way that you did that was incredible at the time that you and Callie were both. I know you like liquefied it. Remember that? I remember you
Yep,
using. I think you used that word.
that's
Was it
correct.
liquefied? And then the two of you were pushing together, one of you on each side of me, and you were putting a lot of pressure. It wasn't pain though. It was no pain involved, but it was really a lot of pressure there.
The reason you had experienced the belt of pain, which is the typical definition of um, a symptom that people would see when they have fibromyalgia, is because it was an
Mm,
unusual type of subluxation in the vertebra. It was actually a facet joint. It was actually diagonally cantered and stuck in that position. So that's why it took quite a bit of force to relocate it and put it in the correct position, because it wasn't a simple lateral adjustment, it was a lateral and a vertical adjustment to get it correct. That's why I
mm.
needed Callie's help. So I was so glad we were both there to do it.
Oh, me too. I couldn't like feel everything going back into place, you know what I mean? But I could almost feel it You know, it was like I had a sense that I don't know if it was a sense of that it was happening or if I was actually feeling it. I'm not sure.
Well, I think
But
that's
I could feel that like going together and that it was going to stay together, especially when you said, okay, well, I'm going to solidify it now.
well, I think that's
And then it
correct.
was like, phew,
To say that you had a sense of it, that's the gestalt, the sense of wholeness in the body, where we know
yeah,
something's right, something's the way it should be, the way nature
yeah.
put it together according to the divine blueprint in the first place. And all we
Hmm.
do is follow the blueprint. We're not doing anything special. So not bad for an hour and a half's work, huh?
Yeah, so I guess my feeling about it being a feeling was pretty accurate because that's what it was. It's like, well, I'm not
Correct.
physically feeling, but I'm like, I don't know what it is. I'm just feel like this is it.
And the main
Like,
thing is you notice afterward, your nerves aren't being pinched by the
mm-mm,
mesonomic joint any longer. We
nope,
we started by getting rid of the herniation, part of the soft disc that's between the hard bony discs. I'm not going to use technical terms here. Had herniated. It was squeezed out to one side.
yeah,
So that pressure was putting it back inside. That was part of the pressure. That was the
yeah,
first thing that we did, was to get that back into place and then work on the orientation of the bony disc.
yeah. I could tell that like whenever that stabbing pain would happen, that it was like a herniated disc. I could just tell it was that, without any
And of course,
X-rays or.
they labeled you as fibromyalgia because that's kind of a blanket stamp on it
Hmm.
thing.
Yeah.
When you don't know a diagnosis of exclusion, when they don't know what else to say.
Well, it was metal poisoning.
Yeah, right.
Basically it's and all whatever other poisoning they do.
Now, what we did in that operation with the metal poisoning was simply to remove. It's a sweeping operation we do with one of the deities. If that bothers people, I'm sorry, but we do work with off-world intelligent, benevolent entities who help us heal people. And I think you
Hmm.
actually felt the work going on as they were removing
I did.
all the heavy metals from your body. Can you tell what that felt like?
To me, it's like some other things that is done doing this, this sort of thing. It just feels like a lightening up, like I feel like something's lighter, like internally. That's the only way I can think of to
Some
describe
people
it. That
describe it
that
as
might not be real accurate though.
no, there's nothing inaccurate. Every person
Yeah.
experiences. Some people experience it as a tingling sensation. Some people experience it as like a sense of cool, like a cool water flowing through the body as the toxins are being washed out. So there's no one right answer, Teresa. That's
Right. I just feel lighter, and that's the way I feel, and that's the only word that I really described a lot of this is a feeling of lightness, of being not weight lighter, I wish, but
oh, that will come.
just yeah, oh yeah, I can get on the elliptical now, on and off, without worrying about falling, because I told you I've been a fall risk for a long time, and I've taken some pretty nasty falls.
And you can get on and off without being in
I
severe
can get
pain.
on and off with no problem at all. None. No pain, no nothing. It's awesome. And I'm enjoying being on it.
Well,
Um,
thank you so much for helping us tell our story. I think you can see from all of the foregoing why it's very difficult to communicate to people what we do as GTA in doing psychic surgery and doing psychic interventions that actually affect the real physical body.
yeah.
This is a hard story to explain. Well, thank you
Uh,
so much, Teresa, and
well, thank
keep
you.
getting
Thank you.
well.